Hello viewers, good afternoon, good evening, good morning, depending on where you're watching us from. Welcome back to my EMTCT channel. Today I want to talk about care of a mother who has had her baby safely. She is okay and her baby is okay. We have taken them back to the postnatal ward. Now we want to start taking care of this mother post-delivery up to complete cessation of breastfeeding. As I said earlier, everyone has a role to play in order to ensure that this mother lives a normal and healthy life and gets a negative baby at the end of breastfeeding. She has a role to play, healthcare workers have a role to play, and her partner also has a role to play. So let's start with roles of healthcare worker. What do we do to this mother to help her have a negative baby by the end of breastfeeding? There are 8 packages of care that we give to this mother to help her maintain the suppressed viral load. Number 1, ART. That is now the therapy. I call it therapy because there are a lot of things that we do to enable the mother to take her ARVs properly. We will keep on assessing her adherence. We will also ask her to tell us why she feels that she needs to take her ARVs properly without defaulting. Someone who knows the reason why they're taking their drugs cannot default. Yeah. So we'll keep on giving adherence counseling. Number 2, we will be assessing this mother throughout for a dignified life. Is she living a dignified life? What do I mean by this? A mother who is being abused is a mother who has no reason to live, is a mother who cannot have a mental health status. So if we assess a mother and we realize that she has a gender-based violence, we will link her to professionals who can deal with that. Remember that you don't have to beat your wife up and think that that is the only way of abusing her. We also have emotional abuse, whereby you refuse to give her transport. Sometimes you give her psychological torture, maybe you don't want to talk to her or something like that. We'll also make sure that this mother is counseled on methods of family planning so that she has a voice, she has technical know-how on choosing when to conceive next. We will also assess this mother for her need to resume sexual activities with her partner, and we tell her the importance of using dual protection, that is using a condom. It's very important for someone who is living with HIV to use a condom during an intercourse, even if her partner is also positive, because this is a mother whose viral load we want to keep suppressed. Maybe the partner has a higher viral load. Every time they have an intercourse that is not protected, she is interfering with her viral load levels. So we will counsel her on that. Number 3, we will assess reproductive health needs of this mother. This is a very hot topic that it takes us a long time to convince mothers on need for cervical cancer screening. So many women, after knowing their HIV status, they say, I took a long time to accept my status. I got shocked, I got traumatized, and I'm currently dealing with it, so I don't want to be assessed for cancer. But it is very important for us to assess mothers who are living positively for cancer, because right now we have ways of managing this problem if we get it in time. It is staged from stage 1 to the last stage. So the earlier we get it, if we get it in time, we can manage it. So why are mothers who are HIV positive prone to developing cervical cancer compared to mothers who are not HIV positive? It is because human papillomavirus is a virus that is common in the genital tract of almost every woman below the age of 30. Most of the time, if you do that test, it can turn positive. There are different strains, but we only have strain 16 and 18 that can cause the cervix to change. So even strain 16 and 18, by the time a lady is reaching 30 years old, your immune system is able to eliminate them out of your system, even if you had them. So people who are HIV positive are people who have most of the time their immune system is compromised. So when your immune system is compromised, it means that your immune system will not be able to work on these strains of human papilloma virus. So when you test them at 30 years, they can still test positive because they do not have enough immunity to remove this from their system. So we will screen them for that. And for also reproductive health issues, we will assess if they want to conceive again or not. Then we give them a method of family planning that is appropriate. Also in family planning, we will teach them the best method for them, because some methods of contraceptives are not good for some types of ARVs. You can be taking your ARVs properly, and you are also taking you're also using certain types of contraceptives, but you still conceive because ARVs reduce the effect of those contraceptives, so you are not properly protected. So we will have your healthcare provider will have to advise you on the best method. Another thing that we do to a woman who has just delivered is we put them on prophylaxis. If she's someone who has never used TB preventive tablets, we put her on these tablets that she takes for a short time, and she will never take them again. Once you've taken these tablets, they prevent you from severe forms of TB, or even getting tuberculosis, because TB is one of the opportunistic infections that people who are living with HIV do get, because so many people have TB in a latent form, meaning that you have the bacteria in your system, but because your immune system is strong, it is not becoming pathological. It is there and it is not affecting you. So if your immune system is compromised, it progresses to TB disease. We also just give them Septrin to prevent other opportunistic infections. Another thing that we do to this mother is we screen them for non-communicable diseases. Non-communicable diseases are chronic diseases that people live with, like hypertension and diabetes. If we make a diagnosis of any, we manage as soon as possible, because remember, there's a lady whose immune system is already compromised, so we don't want her to start having other health issues that we can deal with. The earlier, the best. Another thing that we do for this mother is we assess her for depression or anxiety. We also assess her for drug use. There are some people who, when they are stressed or when they have anxiety, they take maybe alcohol. But remember that when you're HIV positive, you are supposed to use ARVs forever. And ARVs, they pass through the liver. Liver is very vital to someone who is taking ARVs. You need a liver that is functioning properly. But alcohol interferes with normal function of the liver. That's why we advise people who are taking ARVs not to take alcohol, because if you like taking alcohol, after some time your liver will fail, and when your liver fails, I'm sorry to say that it will be the end of you, because ARVs will not be able to work properly, and you'll start developing other severe symptoms of hepatitis, that is a disease of the liver. We will also assess this mother for nutrition. Remember, this is a mother who has just had her baby. She has lost blood. We will teach her on how to eat a balanced diet, which is very necessary. Someone who is HIV positive is someone who is not supposed to lose weight. Weight loss is something that we consider as a serious issue that we will always want to deal with. If you are given iron tablets to boost your blood, remember not to take them at the same time when you are taking your ARVs. If you are taking your ARVs in the morning, take your iron tablets in the evening, because iron tablets reduce the effects of ARVs. We will also assess this mother on other infectious diseases that she can prevent. We will advise her on personal hygiene, to use safe water and clean food, so that she just prevent any other problem that may arise due to poor sanitation. I think that I've mentioned 8 packages of care, so I will go to what is the role of the partner. I want to tell people that a mother who is HIV positive is a mother who sometimes when she sits alone, she's not happy being positive. And when she sits alone and she's sad at times, it means that she's having mental health issues, maybe mood swings. A mother who has been having mood swings before delivery is a mother who can have something we call postpartum blues. That is someone who is developing signs of, I don't want to call it madness, but change in the way in her behavior. Do you know that some mothers can even become mentally challenged after giving birth? This is normally caused by previous depression or anxiety issues before delivery. Like you see these ladies who, when they want to be in their periods, they become very hostile. They can develop this problem. So men, you need to be very kind to your wives, be very supportive. That is all they need. Provide financial support, help her. If she is so tired, just help her with the baby. Just be loving. That's all we need from you. Then what is the role of this lady? The role of this lady is to follow our instruction, to make sure that the 8 packages of care that we've given to her are followed to the letter. Then the package of care that we give to the baby is we'll make sure that your baby is immunized against immunizable diseases. We will be checking the weight of your baby. We will be checking the milestone. Is your baby behaving appropriately depending on the age? We will screen your baby for TB, and remember this is a baby who is exposed to HIV. We will put your baby on Septrin as a prophylaxis from 6 weeks. We will encourage you to give your baby prophylaxis until complete cessation of breastfeeding. That is 6 weeks after. That is nevirapine, because zidovudin is stopped at 6 weeks. We will also be doing follow-ups of tests for your baby. The first test we do at 6 weeks, that is PCR test, then at 6 months, then at 1 year. At 1.5 years, that is 18 months, we'll do an antibody test. And if you're still breastfeeding, we will do the last test 6 weeks after breastfeeding for your baby, hoping that your baby turns negative. Yeah, so that is what we do to mothers who are living positively. So in my next video, I am going to handle how a mother is supposed to live with a baby who is HIV positive and the whole family. Maybe she has other kids who are not HIV positive. Yeah, how do you explain to your kids why this one is on drugs every day? They'll be questioning. Maybe a baby who turns positive, how do you handle that? So like, subscribe and share so that when I post the next video, you'll be notified. Thanks for watching. If you have any question, please leave it on the comment section. I will answer it. Thanks for watching. Bye.